Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thanks for watching our channel. We have almost 17 million views right now, and that means a lot to me. Today we're going to be talking about Rhinophyma. Now, Rhinophyma is a kind of a skin disease process of the nose, and it's really a form of rosacea that's very advanced, and rosacea is sort of adult acne, and I believe there's a hereditary component to this possibly. And what happens is people have very overactive sebaceous glands. These are the glands that make the oil around the face, and they get overactive and they get clogged, and they get this very lumpy, bumpy tissue on their nose, and it can be quite disfiguring. So it is a social problem because people walk around these very big noses and very big lumps on their nose, and sometimes it hurts, it can get infected, it can ooze, it can get very red in the winter, so it's a problematic situation. Unfortunately, some people don't realize that the treatment is pretty easy, and they walk around all their life with this great big disfigured nose. For any of you old movie buffs, W.C. Fields is kind of an example of Rhinophyma with that big bulbous nose. So what we do to correct this is we actually have to sculpt this excess tissue. And I'm just going to show you some video, and some of you might find it disturbing. And what we're doing is we're using a device. It's the Elman radio wave surgery, and it's a special wire for Rhinophyma. It's like a cheese wire where you cut a piece of cheese and it cuts the exact depth. So we're going to use this to shape and recontour the nasal tissues, and then we follow up immediately. We're going to use the Syneron Candela core CO2 laser, and we use that then for our fine-tuning and sculpting to smooth everything. So we have to literally peel off, it's almost like sculpting clay, peel off this diseased tissue. And so at first it's very bloody, and it's red for a couple weeks, and we're going to follow one patient. I have other videos on Rhinophyma and pictures on my website, LoveThatFace.com. So stick around and we'll show you how we do this, and we'll follow this patient through his surgical procedure. I'm Dr. Joe Niamtu, LoveThatFace.com. So this is a Rhinophyma. It is the terminal part of rosacea where you have very enlarged pores and sebaceous glands, and you have all this thickening. So we're going to do our best to reduce this as much as we can, and we're going to probably excise this area right here, and we're going to recontour the rest with the Elman radio wave electrode and the CO2 laser. So this is one of the Elman radio wave electrodes that's insulated. I call this a cheese cutter electrode because it is only gonna cut through to that depth. It's limited, and this is used for harvesting palatal grafts. It's very useful for this as well. So we'll show you how this works. Let's suction a little bit. And we're gonna wipe this off. And you'll see a lot of sebum from the sebaceous glands as we go through this. And these glands, if you squeeze them, you'll see a lot of sebum that will be expressed. So what we're going to do, you can see we're contouring this, so we'll continue. And we're just removing the successive layers. Of this. And then we'll contour it to the normal contour of his nose. Now we're going to express some of the sebum from these sebaceous glands. And you can see here that there's a combination of blood and of the white sebum, and we're going to scrape that off, and then we're going to do our final contouring on this, and we'll go ahead and control that bleeding. And this is the Syneron Candela core laser, and we're using this on fusion at the maximum setting. And this is not only hemostatic, it'll stop the bleeding, but it's going to shrink and tighten these tissues and help me contour this to a smoother contour. And also blend the edges so there's not a steep drop off. So we've been at this about 40 minutes and we have really contoured this as much as I feel comfortable right now. And you have to remember that the heat goes deeper than we can see, so this is actually going to be a deeper treatment than you see. But I'm pretty pleased with what we've achieved. And at this point we'll take the laser and do some final contouring and smooth down bumps and stop any bleeding. And I know our suction's very loud, but this is the Syneron Candela core laser, and it is set on the highest fusion settings, which is some of the more aggressive treatments on this machine, where you have a superficial setting mixed with a deep setting. So that's how we do our Rhinophyma. I'm Dr. Joe Niamtu, LoveThatFace.com.